Welcome to my world. Welcome once more to another episode of Knowledge Appreciation. Health is wealth, knowledge is power. Today I shall take you on bone problems. Most of the words we hear like osteoporosis, osteomyelitis, osteoarthritis and osteo this or osteo that has to do with bone problems. These problems need to be well differentiated so that we can understand it very well. If we do not know the problems, then we will not be able to help in helping others to diagnose the problems they have. I shall now use the slide section to explain the differences between osteoporosis and osteomyelitis as well as the diagnosis. So let us stay hooked so that we can acquire more knowledge and be able to help one another as well as helping ourselves. If you like this presentation, if you like this my channel, press the subscribe button so that you are notified every time the production is out. Bone problems, osteoporosis, osteomyelitis examined. That's the topic for today. The outline is introduction, bone problems differentiation, diagnosis, prevention and control, WHO target. On introduction, during bone formation, the osteoblasts secrete materials that make up the bone matrix, and as they secrete them, some of them are eventually trapped and buried in the bone matrix and become osteocytes. So the osteocytes are the cells you see in the matrix representing the bone cells, and these are reinforced with calcium and contain bone marrow where blood cells are made in the red marrow. The fatty marrow, the white marrow, is more or less just for fats, and the other minerals stored there. Bones are connective tissues because their cells are wide apart, separated by extracellular matrix, and they work with muscles and joints to hold our body together and also for movement. This is called the musculoskeletal system. Now let us look at the connective tissue. This is a connective tissue. You can see these representing the osteocytes, the nucleus and the cells. These represent the fibers, which represent the matrix and the ground substance, all together called the extracellular matrix. That's what makes them a connective tissue. The bone anatomy itself, you can see the bone is made of three parts. The compact bone, then we have the spongy bone. This is the spongy bone. Then we have the bone marrow, which consists of both the red and the yellow marrow. The yellow marrow contains mainly fats. Now let's talk about the bone problem differentiation. You have problems called the osteoporosis, which I will talk about later. The osteomyelitis, also to be spoken about. The osteoarthritis is the septic arthritis defined by infection within a joint. It is not a bone problem per se, but a joint problem. Osteopenia has to do with the bone, and osteonecrosis is bone death caused by poor blood supply in the hips, shoulder, other large joints such as the nail, elbow, wrist, and co. Then you have osteosarcoma, which has to do with cancer of the bone. The osteoporosis. The WHO Health Organization has defined osteoporosis as a bone mineral density problem, more than 2.5 standard deviation below the young normal mean. You will see how it is. The young normal is taken as a 30-year-old male. Osteopenia is defined as bone marrow density, the bone mineral density between 1 and 2.5 standard deviation below the young normal mean. And the osteomyelitis is an inflammation of swelling of bone tissues. It is most often the result of an infection. It can affect all people, but it is more common in infant children and older adults. The causes are listed. Osteoporosis type 1 includes postmenopausal or estrogen deficient women. Osteoporosis, which is observed in women whose ovaries have ceased to produce the hormone estrogen. The age-related osteoporosis is the type 2 type, which affects those over the age of 70. And idiopathic osteoporosis is a rare disorder of unknown cause that affects premenopausal women and men who are middle age or even younger. Then there is the recent development, the recent research finding, a gene that determines the type of vitamin D receptor, VDR, a person inherits. The VDR gene exists in two forms, one of which produces a receptor that stores calcium more efficiently than the other. People who inherit two copies of these more efficient VDR genes develop high bone density. Those who inherit two copies of the less efficient gene have somewhat less strong bones. So you can understand where osteopenia, osteoporosis come about. Osteopenia is vulnerability sustained a vertebral proximal humeral pelvis, or in some cases, distal femur fracture. WHO classified as preclude fracture risk algorithm, FRAX. Then we can talk of osteomyelitis, which includes having a bacterial infection in the blood, an injury or surgery, frequent medicine injection, diabetes or a weak immune system, and a prosthetic device. The prosthetic device is when you perform invasive medical solution. I mean, when you are trying to solve a problem by invading the inner organs of the patient and thereby causing other problem or infection and what have you, which will result in these later problems of the bone or infection of the blood, etc., etc. Osteoporosis diagnosis is by clinical. The clinicians are very good at that. Then a bone mineral density test measures how much calcium and other types of minerals are in an area of your bone. This test helps your healthcare provider detect osteoporosis and predict your risk for bone fractures. The most commonly used BMD test is called a central dual energy X-ray absorptiometry or central DXA test. It is painless, and the test can measure bone density at your hips and lower spine. This is an instrument that is used to measure, and you can see the gradients. So when the deviation, the standard deviation is to the left of the 30-year-old young adult, you have osteoporosis showing -1 standard deviation, porous bone that can lead to fracture. This is slow bone osteopenia, and then you have the normal bones at this stage. That's the diagnosis at the clinical level. Osteoporosis was defined by World Health Organization in 1994 as a T-score that is 25% lower than the average 30-year-old, or 2.5 standard deviation below the mean of a T-score lower than -2.5. This is the -2.5. Laboratory diagnosis you talk of osteomyelitis affect all age groups and develops from various sources, including hematogenously from distant infection foci. When you're talking of hematogenous, you are talking of blood infection from external sources, such as postoperative or post-traumatic wounds. That could also pass later to the blood infection, and from adjoining soft tissues infections. Staphylococcus aureus, strep, pyogenes, and Haemophilus influenza are the most common pathogens of hematogenous osteomyelitis. Aerobic and facultative gram-negative bacteria have emerged as significant pathogens in some type of osteomyelitis, while anaerobic bacteria are increasingly recognized as potential pathogens in non-hematogenous osteomyelitis. Blood culture is also, from what we have said, once it's hematogenous, you can think of blood culture to really find the causative organisms which has been predicted as Staph aureus, strep, and co. Then the wound swab too of the operation sites. You can also do complete blood counts for infection to know whether there is an increased level of the WBC, that is the white blood cells. The erythrocyte sedimentation rate, which checks for inflammation and infection. This C-reactive protein also checks for infection, though both are not specific. Then you have the aspiration, the biopsy that can be done to really look at the tissues. And then the other tests include the X-ray, the radionuclear bone scan, the CT scan, the MRI, and the sonography. These are all what can be done to really diagnose the infection of osteomyelitis. Prevention and control by WHO intervention is the agreement. There is an agreement between WHO and the European Society for Clinical and Economic Aspects of Osteoporosis, which includes the development of a public health strategy and action plan to prevent fractures among older people, as well as to improve the coverage of health services for fractures, which are critical for achieving the $3 billion target of WHO 13th General Program of Work, GPW 13. You can understand that this does not target eradication. Then there is also the WHO Patient Safety Program, integrates efforts with other WHO programs to reduce these health communicable problems by assisting with the assessment, planning, and implementation of infection prevention and control policies, including timely action of national and at the international level as well. It's also to provide guidance to countries on using data to design evidence-informed policies and programs to reduce the risk of fracture in older people. Thank you for listening.